Hello everyone, my name is Malak Salah. I'm going to talk about the first part of the middle third fractures. The surgical anatomy. The facial skeleton divided into the three areas. The upper third is frontal, the lower third is mandible, and the middle third in between the frontal bone and the mandible. The middle third of the face is the area bounded by superiorly by a line drawn from the zygomatico-frontal suture across the frontonasal and the frontomaxillary suture to the zygomatico-frontal suture at the opposite side. In the inferiorly by the occlusal plane or the alveolar ridge, and posteriorly as far as the frontal bone above and the body of the sphenoid below. The middle third, as you see, the central middle third and the lateral middle third. The classification of the middle face fracture by Rhine-Lefort. The Lefort one, also called low-level fracture or Guerin fracture. The Lefort two, also called pyramidal or subzygomatic fracture, and the Lefort three, high transverse or suprazygomatic fracture. The general clinical feature: airway obstruction, epistaxis, CSF rhinorrhea, facial oedema, emphysema, occlusal disturbances, orbital septum, abnormal opening of the mouth, and the oronasal opening. As you see, Lefort 1, Lefort 2, and the Lefort 3. The Lefort 1 fracture. Violent force over a more extensive area above the level of the tooth will result in the Lefort 1 fracture. The horizontal fracture line seen above the apexes of the maxillary tooth, detaching the tooth-bearing portion of the maxilla from the rest of the facial skeleton. The fracture fragment is freely mobile and displacement will depend on the direction of the force. Depending on the displacement, a variety of the occlusal disharmony can be seen in this type of the Lefort 1 fracture. As you see, the fracture line commences at the point on the lateral margin of the anterior nasal aperture, passes above the nasal floor, and it passes laterally above the canine fossa and it transfers the lateral antral wall, dipping down below the zygomatic buttress and then incline upward and posteriorly across the pterygomaxillary fissure to fracture the pterygoid laminae at the junction of their lower third and upper two-third. At the same time, from the same starting point, the fracture also passes along the lateral wall of the nose to join the lateral line of the fracture behind the tuberosity. The Lefort 1 fracture, mostly bilateral, sometimes unilateral depending on the displacement, direction, and severity of force, may occur as single entity or with Lefort 1 and 2 fracture. The sign and symptom of Lefort 1 fracture. The extraorally sign is slightly swelling and edema in the lower part of the middle face and the upper lip. Epistaxis may be observed, pain and mobility, air emphysema in some cases. The intraorally sign and symptom of the Lefort 1 fracture. The floating maxilla, impacted or telescopic fracture, anterior open bite, ecchymosis, mid-palatal split in some cases, damage or subluxed tooth, and the Guerin sign. The Guerin sign characteristic by ecchymosis in the region of the greater palatal vessel. The treatment of the Lefort 1 fracture is direct exposure of all involved fracture, reduction and anatomic realignment of the maxillary buttress to reestablish the anterior projection, transverse width, and occlusion. restoration of the occlusion using intermaxillary fixation and internal fixation using mini plate fixation. Thank you for listening.